Hello, Dr. Ragland. Welcome to Wake Up with Marci.
Hi, how are you? Thank you so much for having me on the show.
I'm so glad to have you because you are going to speak with us about wintertime foot care, which we could all use, the maintenance, because our feet take a toll during this time. But I first want to talk about the difference between DPM and MD. So can you share a little bit about that?
I'm really glad that you asked that question, Marcy, because a lot of people do not know the difference. They hear that I'm a doctor, they hear that I'm a surgeon. And so a lot of people they go right to medical doctor, but DPM actually stands for Doctor of Podiatric Medicine. So podiatrists are doctors with a limited scope of practice to the foot. Our latitude of practice varies from state to state. So for instance, in Michigan, podiatrists can actually work on hands. Our schooling includes anatomy and medical sciences of the entire body for the first 2 years. In the latter 2 years, we're entrenched on the lower extremity, focusing on the foot and ankle. And we, as podiatrists, are able to perform surgeries and prescribe medications just like regular medical doctors do.
Okay, well, let's talk about the feet and and the help that you give. So let's talk about the most common problems that you see, and also how our feet can affect our overall health. So interesting.
Well, okay. Well, first of all, I always believe this. I learned this very quickly in medical school, working in the clinics. When your feet hurt, everything hurts.
Hmm.
So that's just number one. But in my specific practice, because my practice really does focus on forefoot reconstruction surgery. So the forefoot is, to pull up my foot model, is the front part of the foot. And so in my practice, my particular practice, I often see patients for bunions, uh, hammer toes, corns on the toes, and
Mm.
Taylor's bunions. So the Taylor's bunions are usually associated with the big toe on this side of the foot. The Taylor's bunion is on this side of the foot, and it's
Mm.
called a Taylor's bunion because back in the day, tailors used to use the pedals of
Oh,
the sewing
yeah.
machine, and they would get a big corn on this side of their foot. So hence it was called a Taylor's bunion. And also I will see patients to perform a procedure called a plantar fasciectomy, which is associated with plantar fasciitis, which in layman's term is called heel spur syndrome, that awful pain that many people get with the first few steps.
I know, it's so painful,
Yes,
incredibly painful. Corns can be painful. Anything that you're talking about is extremely painful.
absolutely.
And the but there is help, and that's what you provide, which is amazing. But on a little funner note, we're going to talk about how we can keep our feet looking good during the winter time, because we care so much during the summertime, but how can we help ourselves during the winter time?
But here's the thing. I see this uptick in the wintertime, especially with ladies. It happens with men too, of course, but
Yeah.
especially with women. They come in and I see a lot of ingrown nails. I see a lot of fungal nails. I see a lot of the athlete's foot in the wintertime. And so I posed this question to them when I started seeing this. I'm like, well, what's going on? Why am I seeing this so much now? And I wasn't seeing it in the summertime. So I started asking them, like, are you getting pedicures now? And they're like, no, not really. And I'm like,
Mhm.
why? And they're like, well, I'm not really wearing sandals.
Yeah.
And so I started realizing that ladies are not really doing that sort of self care because they're like, my feet are not being presented. So they're not going in to get their nails done. And so I want everyone to know that getting a pedicure is not just about pretty nail polish. I mean, it is really therapeutic. You're getting a lot of dead skin and debris out from in between the nail fold and the skin. And what that does is allow that nail to grow out properly so it doesn't become ingrown into the skin. The other thing that your pedicurist is doing is they're cutting your nails properly. So you're cutting straight across. So I'm going to use my fingernail. You're going to they cut straight across. But when your nail becomes ingrown, it's painful, and it's very intuitive to take your nail nipper or clipper and go down in the corner and cut it out. That
Right.
can actually make the condition worse.
Oh,
So,
wow.
so,
Yep.
so that's something you don't want to do. So what I'm trying
Yep.
to say, Marci, is that
Uh-huh.
in the wintertime, please continue to go treat
Yes.
yourself to pedicures.
You
It's
got to keep
okay.
taking care. That's
Yes.
right. That's right.
The other uptick I see are the fungal nails and the fungal feet. So I want you to, so ladies that suffer with fungal nails or athlete's foot, just get yourself some sort of antifungal cream or a topical solution to put on the nails so that we can keep that at bay, because fungus thrives in dark, warm, moist places. And
That's in your feet and your shoes and your socks,
there
right?
you
Oh, well, Dr. Ragland, how can we find out more information? Because this is really important and that we keep up with this and find you. So please tell us.
Okay, so I'd like all of you to please follow me on Instagram, Fix Your Feet. That's my company, Fix Your Feet. You'll find me on fixyourfeet.com, and you'll also find products of mine on fixyourfeetproducts.com.
Oh, fantastic. So you offer products too. Well, Dr. Ragland, thank you so much for coming on. So important that we take care of our feet. And thank you again for
Absolutely.
sharing some really important information.
Thank you for having me.